Thousands of people in England are using their life savings to pay for their long-term care, which should be funded by the NHS, specifically NHS clinical commissioning groups. And perhaps you are one of these people, someone in your family is. One expert has told this programme it's a national scandal. Many people have been forced to sell their homes to pay for the care. NHS continuing healthcare funding is for patients with significant health problems, sometimes multiple health problems, and they should have such care costs paid in full if the condition is deemed to be the main reason that they require such help. Figures obtained by this programme show the Parliamentary and Health Service Ombudsman investigated 496 complaints about CHC funding last year. Campaigners claim it's a deliberate strategy by health officials to cut spending on the care, even though it's a legal right for tens of thousands of vulnerable patients. Noel Phillips has this exclusive film.
When 83-year-old Joyce Bryant fell ill 2 years ago with viral encephalitis, it left her with a substantial brain injury and unable to care for herself. It became the tipping point for her health. She's now bedridden and weighs around 7 stone.
Her behaviour was just manic. She was banging on windows, she was hitting out at my dad, pulling plugs out of the sockets in the hospital ward, and staff were having it to take it off of her. She put herself on the floor and was hitting the mattress. It was just totally abnormal behaviour, and that's when we started with the CHC process.
So what is CHC, or continuing healthcare?
Clinical commissioning groups have a legal duty to offer personal health budgets to those who are eligible.
It's a government scheme where the NHS is responsible for funding the nursing cost of people with complex medical conditions. Those who apply are judged according to national criteria guidelines, one of which is on predictable healthcare needs. Every year, around 160,000 applications are made, costing the NHS around £3 billion. Nurses from clinical commissioning groups assess patients like Joyce, but she was turned down for continuing healthcare funding by West Hampshire CCG last year.
She destroyed her glasses. Let me just show you her nightie, and how much more evidence do you need than her instability? And
she's ripped that nightie.
She's ripped that nightie. It's all documented, yet they came back and said her behaviour was not unpredictable, it could be anticipated.
But Lynn says despite providing clinical documents and videos showing her mum's aggressive behaviour,
this was my special date as well as yours.
Gently, Mum, gently with Dad.
Her local clinical commissioning group found that her needs did not meet their criteria for fully funded NHS care.
Have you had your tea yet, Mum?
No, I haven't quite finished.
To come back and say that her behaviour was not unpredictable, I don't know. I can't understand their rationale to the situation, but it's unfortunately it's what's happening. The bottom line is it's happening, and it shouldn't be happening.
Joyce's health is deteriorating. Her GP has now placed her on an end-of-life palliative care register. Her husband Pete, who is in the early stages of dementia, has had to spend most of their savings on her 24/7 care needs, which he says should be provided by the NHS.
She's just like a cabbage now, if you can call it that. We were always together, weren't we? Always together, always go out together. But now, no chance of it at all.
How are you feeling today, Joyce?
Still a bit tired. Nice to get out and have a chatting a smile with somebody else.
The family say their savings to continue caring for Joyce are running out. They're eligible for care home funding, but they say that is not an option.
I need some help. Yep. All right, Dad. It's all right. Mum and Dad have always wanted to stay in their own home. Haven't you? You've always wanted to stay in your own home together.
Yeah.
They've been married 57 years. If I genuinely thought that a care home was the right place, then I wouldn't think twice, but they've never wanted to go into a care home. To be honest, it would be disastrous for Mum, because she wouldn't get the care that she's getting home here when she's having the days where she won't eat, she won't drink. And if I mention to Dad about a home, he just says, I will kill myself if I go into a home.
For Joyce to remain in her own home, she will need continuing healthcare funding. We contacted the family's clinical commissioning group, West Hampshire, who told us,
"We are very sorry that Mrs. Bryant and her family are experiencing such a difficult time. Decisions on Mrs. Bryant's case were taken by a panel of health and social care professionals and with input from her GP. Unfortunately, Mrs. Bryant did not meet the nationally set criteria within which all NHS commissioners have to operate."
Figures we've seen from the Parliamentary and Health Service Ombudsman, who oversee complaints into continuing healthcare, show nearly 200 cases were investigated in the last year, which is why some campaigners have accused local clinical commissioning groups of deliberately withholding funding in order to avoid making payments.
There are thousands of people who have been forced to sell their houses to pay for the care in circumstances when they perhaps ought not to have had to do so. The problem is that a lot of people don't know of the existence of this funding, and even those who do know about it have difficulty in navigating the complexities of the system. It is a national scandal that people are not being signposted to this funding.
Here in Wiltshire, the percentage of people like this family getting access to continuing healthcare funding is amongst the lowest in the country, leaving many with significant healthcare needs being denied free care.
This is the dark side of the NHS. This is a hidden side. This is the disabled side, the dementia side, the Alzheimer's side.
John Morrison has cerebral palsy, which means he can't use his arms or legs. His funding was withdrawn in 2009 because he no longer met the criteria for continuing healthcare, despite his condition remaining the same.
Fighting for John has nearly broken me. Watching somebody disappear when you know that for a simple amount of money it can be stopped. It's depressing, it's demoralising, it encompasses every conversation I have with my lovely husband, who sometimes just turns off because he's heard what I've said so many times.
You'd like to give up sometimes, but I can't, because I won't give up. It's not what we do.
A decade later, and their battle for continuing healthcare funding has paid off. In the last week, Wiltshire Clinical Commissioning Group has concluded that John now qualifies for fully funded care. His parents say they now intend to claim £300,000 back from the NHS, having spent their own money on his care.
I am relieved because now the three of us can have a normal life again, a family life. Very happy.
For some though, it hasn't been a happy ending. A recent report by the Public Accounts Committee found that some people have died while awaiting a decision on their continuing healthcare applications. NHS Clinical Commissioners, the body which represents CCGs, has told us health officials must operate within the confines of the law and that they're working hard to improve the process to make it fairer for those that need it. There are some people who are suggesting that the NHS is unlawfully holding funding back to those who are lawfully entitled to it.
Well, you're absolutely right that it is a requirement that this is being provided to people who meet the criteria. And when you know that some assessments in some areas are taking over 100 days, that's 3 months that someone's waiting, living through something without the support they need, that's just not acceptable. And these differences in waiting time couldn't be explained. So there's a lot wrong with the system, and there needs to be real political will behind this to make sure that those who are eligible are getting the money they need, because it's often a short window for people that they need the money, and if they don't get it quickly, they may never get it at all.
Philip Matthias, a retired Rear Admiral, says his mom was desperate for healthcare funding, but by the time it was approved by the local clinical commissioning group, it was too late. He successfully claimed £200,000 back from the NHS for the care his family had already paid for.
Well, when I eventually won the case on behalf of my father, I mean, sadly, my mother died just at the end of that process. At the independent review panel, eventually I recovered a total of £200,000. At a national level, in my view, this is probably the biggest financial scandal in the history of the NHS, financially talking. And over the last 5 to 10 years, there will be thousands, possibly tens of thousands of people who will have been denied this funding.
We asked NHS England for an interview to discuss the problems people are having with continuing healthcare, but instead they sent us a statement.
Spending on continuing healthcare is increasing, and it's for CCGs to manage assessments based on demand in their area. There is still potential, however, to make the process more efficient and effective for patients, as the majority of people assessed turn out not to be eligible.
You're dealing with a very challenging, situation involving your mom, and you're also having to deal with a system that is, incredibly difficult and very complex to understand. How are you able to get through all of this?
It shouldn't be like that. Mum and Dad are of the generation where if they couldn't afford it, they didn't have it. They saved hard to better themselves. They saved hard for their retirement. And they've stood on their own 2 feet all their lives, and now they need that help, and it's just not there. It's just devastating.